Good afternoon, everybody, and welcome to the Go Wellness Practice Accelerator Challenge. Today's topic, we're going to have Dr. Dan Kellams, the amazing Dr. Dan Kellams, be teaching about autoimmunity. So we're going to dive into that. We'll just go over a few announcements. So we had the best time at session 1. Mark your calendars for session 2. It will be June 3rd and 4th. Location to be determined. Dan, hi.
Hey.
Hey.
How's it
Let's
going?
talk autoimmunity.
Let's talk about it.
What you got for us?
There's a lot of it, and it's getting worse.
I wonder why.
It's a tricky thing. Yeah. So I'm gonna dig into some just kind of the mechanisms behind it because we're seeing it a lot, and then some of the basic approaches. Like peptides are great to start to kick it away, but it is a massive problem and it's super complex. So we're going to dig into that. I think, one of the first things about the autoimmune process is just having a basic understanding of some of the deeper details of how the immune system works. This is such a critical piece. So one of the first things that typically has to happen with an autoimmune process is loss of what we call self-tolerance or oral tolerance. Either one. Loss of self-tolerance is where our body starts to attack itself. And that's actually the early piece of that autoimmune. And there's a lot of mechanisms. It's not just going to be, your body errantly starts attacking the immune system. There's a lot of things that can drive it. But one of the first phases that you'll typically see with people, and a common trigger, is loss of oral tolerance. And developing tolerance to things. So you have to think, so anything that comes into your body, like a chemical or a food protein, or any type of even circulating hormones, and even the bacteria in your gut, there's constantly pieces of these things that are getting into the immune system. Because if you're looking at throughout your lungs and throughout the digestive tract, and even in your skin, you have all this lymphatic tissue. And in that lymphatic tissue are all these lymphocytes that are in there, and these macrophages, especially macrophages. They're one of the first things into an immune response is your macrophages. And so they're in there, and they're antigen presenting cells, which means they're going to take these pieces, and they have these things called major histocompatibility complexes. And what they're doing is they're presenting these pieces. They say, okay, here's a piece of this thing that came in, and here it is. And our immune system has all these different, like Lego pieces. It's like Tetris. Does this fit? Does that fit? Is this something that we recognize? And then sometimes there's things that we don't have a fit for, or we absolutely immediately recognizes it a foreign invader. And that's how we develop tolerance. And it's a learned thing over time. And it happens through a lot of systems. Like if it gets in the lymphatic tissue, you got to think it gets into our lymphatic system. It goes to our lymph nodes. In the up here in our venous and arterial system, we have the thoracic duct where it'll empty into our central circulation. And now it's central to our whole body. It's our spleen. In the digestive tract, it goes through the hepatic portal. It can go right to our liver. So we have these white blood cells or these immune cells in our liver called Kupffer cells. So really, tolerance is a systemic thing, right? There's so many different things in our body, but also in the mucous membrane in our nose and our mouth. It's just like our gut, right? So anything that can create immune intolerance can happen in the mouth as well. So the lesson there is, do we have intact barriers? Or is our body able to be selective, right? So that's the first thing. So if people have really bad oral health, first of all, that's nasty. They have like gingivitis and gum disease, and they don't brush or floss or whatever they're supposed to be doing. Everybody's got their own routine. But if you're looking at somebody and they don't have good oral health, like look at their mouth. Like in Chinese medicine, we look at the tongue, but a lot of times we fail to look at their cheeks, the inside of their mouth. Look at those barriers, because it can start there. You want to look at the back of the throat. One of the things I can tell you if there's loss of barrier integrity in the intestinal tract is they have sensitivities to things, right? We can test the upper respiratory and digestive tract when we're looking at labs as the SIGA, that's immunoglobulin A, and that's secreted, so it's got the S. So what it does is it gets out there and it minimizes the impact of all these different food proteins and the overall impact in an irregular immune response to these things coming in. And then those dendritic cells in our digestive tract, those are our mature monocytes. Monocytes will increase and eventually mature once they hit tissues or they enter tissues into macrophages and dendritic cells and microglial or glial cells in the brain. So those are antigen presenting cells. So the first thing about this is when you're dealing with any chronic illness, especially any type of autoimmunity, is make sure that stuff's not getting in that's not supposed to be there, right? Part of that's exposure, right? Cleaning up the house. You know, you need to go through these things when you're doing your initial intake. So we want to minimize that exposure, right? And one of the first things we can do to that is make sure that the physical barriers are intact. The nasopharyngeal barrier, the gut barrier, the blood-brain barrier. There's things that we can do to test those things. With the stool, you can check to see if there's any blood, even in the mouth. You know, when they brush their teeth as they're bleeding, that's not good, right? There's compromise there. Is there any wounds or sores or lesions? Is there any blood in their stool, any mucus in their stool? Those are going to be symptoms of it. Those are all really key. You can do some testing to check the barriers. As far as the SIGA, that's a gray marker for a barrier. Cyrex, they have an array. I think it's array 5, and it checks, do they have, with leaky barriers, you're going to have different markers, right? So let's nerd out on leaky barrier for a second. You're going to check, is it transcellular or paracellular? And what the hell does that mean? It means, is it going through or around the cells, right? So we got to check that. So we check those barriers. We can see, because going through or in between the cells in that tight junction, there's proteins in there, claudin and occludin, and we can test those. We can also check for zonulin. Zonulin leaks, opens up the barriers. And if you want to see some just crazy research, get on PubMed, type in zonulin, and you'll see that it's attributed to anything. Any leaky barriers, especially leaky gut barriers, can cause a lot of long-term issues because stuff's getting in that's not supposed to. And that's a massive trigger. You can see it cause hypertension during pregnancy. It can cause preeclampsia, early birth. It can cause midterm miscarriages. That's just pregnancy. It can cause insulin resistance, diabetes, because it's causing a toxic effect. Because what happens is, just like in the immune barrier, the mucosal barrier in our tracts, our respiratory and our digestive tract, those macrophages and dendritic cells, these antigen presenting cells, when there's toxins coming in, they get activated, they get turned on, and they're on tissues all through our body. So you can activate an inflammatory response all through the body because we have a disrupted barrier. So you'll see issues in the blood sugar. You can see issues directly in the liver. And nobody wants an inflamed liver, right? Nobody wants an inflamed liver. Like I said, check out zonulin, because these, when things get in that aren't supposed to be there, they inflame every tissue in the body, cardiovascular tissue, neurological tissue, everything in the digestive tract, the liver, you name it. There's an inflammatory response just that can be created just because of the increased zonulin or the increased barriers, especially if there's dysbiosis. If the gut has any irregular bacteria in there, especially if it's gram-negative bacteria, they produce lipopolysaccharides. And that causes endotoxemia. So if things are getting in that aren't supposed to, it already is going to create inflammation and cause a lot of disruption. But if anything's in the gut and you have dysbiosis, and that's going to cause a lot of problems. But that array 5, or I think it was the the immunoreactivity panel, it's salivary, and it checks what type of barrier permeability we have. It'll even check markers for the blood-brain barrier, myelin basic protein and blood barrier proteins, the gut barriers, and it looks like at all the common things that cause the weakened barrier. But you can simply look at the white blood cells on the labs, and you see if you have monocytes that are elevated, that's a problem. If you start seeing uric acid elevated, or if you're seeing BUN, because it's made in the liver, excreted by the kidney, and elevation in that, that's a problem. Total protein is a really good marker. Like when you're dealing with chronic disease or autoimmune, is like I said, make sure barriers are intact. That's a really great place to start. And then minimize the external load. Check their foods, make sure they're not getting plastics or chemicals or anything in that, because those chemicals will modify our DNA. It binds to our DNA and modifies them. That's called haptenation. And we don't want that. We don't want modification of these things, because that'll bind to our tissue and totally change the tissue. And now it looks like a foreign body. So that's a good place to start. Get those chemicals out. The next thing that we can do, especially when we're talking inside the body, is looking at all those dietary proteins that are getting in. You mentioned a difference between going around the cell and through the cell. Is there a treatment between those two? Absolutely. That's a great question. So transcellular versus paracellular. So paracellular, usually you avoid the wheat products, minimize, because the thing that causes leaky gut is usually like just lifestyle. Like stress can cause it, eating bad foods, preservatives, having disruption in the gut bacteria. So getting, prebiotics and probiotics, fermented foods, having an anti-inflammatory diet. And then you can take things like repair bite, like the glycine and the glutamine. Those actually help tighten up those barriers and build up that mucous membrane. Transcellular is a different story. That's usually the tissue's been destroyed. And so that's transcellular. So it's getting through, and the marker that'll pop up for that is actomyosin, because that's like at the basement membrane of the gut. So with that, you have to be really careful, and you need to really stop the inflammation. It's more of a serious case. You're going to see more of like celiac tissue destruction, ulcerative colitis, and Crohn's. And so you have to really watch out, and that can be really tricky. That can take a long time, and those people may always have a leaky barrier. So what you have to do is make sure they don't have dysbiosis, and just keep their gut bacteria really healthy. And those take the longest. And one of the bigger problems with that is if food proteins are getting in, and people can develop a food sensitivity, they may not get a long-term trigger. They may just have an increase in their IgG antibodies. The problem is if they're good gut bacteria, the commensal bacteria, if that gets through and the body marks it as a foreign invader, now you have an autoimmune or an inflammatory response to good bacteria. That can actually happen. And those are tough cases, right? You just have to like work at the Chinese herbs and always doing things to support digestion, because every one of us had a person who you get them where they could be, and that's about where you got them, and you just kind of have to keep giving them, keep them on an anti-inflammatory diet, give them lots of digestive enzymes. And this is a clinical pearl, going back to the digestive enzymes. The body responds. You can only have an inflammatory response or an antibody response to a protein. So if it's a chemical, it's because it's bound to a protein. If it's a hormone, it's because it's bind to a protein. And if it's a food protein that's getting through, one of the first things you can do is make sure their digestion is really good. Make sure they're chewing their food. Make sure they got plenty of digestive enzymes. Make sure their stomach acid is healthy, and make sure they have good bile release.
Hey everybody, Reagan Archibald here. I hope you enjoyed the Go Wellness show and maybe learned a couple things you could apply to your practice. If you're a healthcare entrepreneur who wants to work in an academic think tank with like-minded humans, who are just like you, looking to provide better service, better quality of care for your patients, reach us at info@gowellness.com, and we're happy to do a free practice analysis for you.